Bismillahirrahmanirrahim. Welcome to my channel, Science of Life with Dr. Mohammed Yusuf. Today I am going to talk about cardiac failure. This lecture I will take in two parts. So today first part of the cardiac failure. But before that, one ayah from Holy Quran, Surah Nisa, ayat number 17. A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. إنما التوبة على الله للذين يعملون السوء بجهالة ثم يتوبون من قريب فأولئك يتوب الله عليهم وكان الله अलीमन हकीमा। बेशक तौबा इन्नमा तौबा तो बेशक तौबा की कबूलियत का हक उन्हीं लोगों के लिए है जो नादानी से कोई बुरा फेल कर गुजरते हैं, या मलून सूअ बिजहालतिन, कोई जहालत से गलती गुनाह का काम कर बैठते हैं, सुम्मा यतूबून मिन करीबिन, फिर जल्दी ही तौबा कर लेते हैं और इसके बाद जल्दी ही तौबा कर लेते हैं, और ऐसे लोगों पर अल्लाह अपनी नजर नाय से फिर मुतवज्जे हो जाता है। फौलाइक यतूबुल्लाहु अलैहिम, अल्लाह भी उनकी तौबा कबूल कर लेता है, अल्लाह भी लौट आता है उनके लिए। वकान अल्लाहु अलीमन हकीमा, और अल्लाह तो सारी बातों को जानने वाला है और हकीम और दाना है, उसको सब पता है। तो गलती हो जाए किसी से, और गलती अव्वल तो मुस्लिम होने का मतलब है कि हमने अल्लाह की सारी बातें माननी है, और अगर कोई गलती से गुनाह कर बैठे तो एहसास होते ही फौरन तौबा की जाए। अल्लाह पाक समझ अमल की तौफीक अता फरमाए। So I'll talk about the cardiac failure. What is cardiac failure? Heart failure or cardiac failure? A state in which the heart is not capable of pumping the required amount of the blood to all parts of the body. A state which the heart cannot provide, in which the heart cannot provide sufficient cardiac output to satisfy the metabolic needs of the body. Heart has to supply the enough blood for all the metabolic needs of the body. If it is not providing that, it is heart failure, it is cardiac failure. So it is commonly termed as, it is known as heart failure, congestive cardiac failure, congestive heart failure or congestive cardiac failure. Why congestion? Because we are going to see, because the symptoms of increased venous congestion, venous are more prominent in this. The person is lying on the main features, the apparent features which we observe in the patient of heart failure is venous congestion throughout the body in the form of venous congestion, and excessive edema occurs in pulmonary edema in left ventricular failure, and generalized edema in the right ventricular failure. But venous congestion is the prominent feature, feature in the cardiac failure. So that's why it is commonly called as congestive cardiac failure or congestive heart failure. Now, when the heart fails to obey the Frank-Starling's law, what is cardiac failure? One of the property of the cardiac muscle we discussed several times. We were talking about many times and throughout this discussion on circulation or heart. Frank-Starling's law. What is that? Heart is capable of pumping all the venous return. Venous return is always equal to cardiac output is always equal to venous return. If venous return is 5 liter, heart is pumping 4.9 liter, this is cardiac failure. When heart is not obeying the Frank-Starling law, when heart failure occurs, fails to obey the Frank-Starling's law, what is that? All the venous return cannot be pumped by the heart. This is heart failure. So when this equation, it should be equal. Cardiac output is always equal to venous return. If cardiac output is less than venous return, then this is cardiac failure. Because this extra blood, venous return which is coming to the heart, if 5 liter is coming, this 5 liter has to be pumped. If 10 liters or 25 liters is coming, we have discussed it. There are cases when the tremendous increase in the venous return and cardiac output does occur. So if the venous return is 25 liter and heart is pumping only 10 liters per minute, 19 liters per minute, this extra 1 liter will go where? It will be pooling in the veins. There will be enough pump and it will be back pressure will be developing. So cardiac output will be less than venous return. This is heart failure. There are two important consequences of this. When venous return is more and cardiac output is less, this cardiac output, reduced cardiac output, it is less. Reduced, it is not according to the requirement. It is less. Reduced cardiac output and damming of the blood in the veins. If the left ventricle is not pumping properly into the aorta, venous return, extra blood will be pooling in the left atrium or into the pulmonary field or into the veins in the pulmonary region. If the right ventricular failure is occurring, the blood will be pooling in the right atrium, that is central venous pressure will be increasing, right atrial pressure will be increasing, right atrium and blood will be pooling in the systemic vessel, all the veins, superior and inferior vena cava. The blood will be pooling throughout the venous systemic veins and it will cause edema throughout the. So left ventricular failure, we are going to see left ventricular failure will cause damming of the blood in the pulmonary circulation, because the left ventricle is receiving blood from the veins coming from the lungs. So there will be congestion of the pulmonary veins, so pulmonary edema will occur. And in right ventricular failure, the superior and inferior vena cava are bringing the blood from all parts of the body, so there will be generalized edema in the right ventricular failure. So the two important consequences of this heart failure, that is when cardiac output is less than venous return, that is reduced cardiac output and damming of the blood in the veins, venous congestion. Causes of this, what can be the cause of this heart failure? Why the heart cannot pump all the venous return? What can be the cause? It is the property of cardiac muscle, we have discussed it. Normal cardiac muscle can pump all the venous return. In the athletes we have seen up to 35 or 40 liters per minute venous return can be handled by the heart. So what can be the cause of this heart failure? It is a common endpoint of many diseases of the cardiovascular system, which we are going to see many diseases. For example, it can be caused by the heart failure. Cause of heart failure, etiology, causes of the heart failure, inappropriate workload. If the workload on the heart is more than what heart can pump, if the heart is capable, if I am not athlete, for example, my heart maximum ability of my pumping in a normal person may be 25 liter with the overactive sympathetic stimulation, etc. We had discussed the cardiac output curve. Dobara bhi aayenge, we will see those cardiac output curve. So if the venous return is more than 25, so this workload on the heart, my heart is not capable of handling this much load. So inappropriate workload. We are going to see how the workload can be inappropriate, cannot be coped with the heart normal cardiac activity. Volume load. If there is excessive volume of the blood which the heart is not capable of pumping it, or the pressure load. If the heart pumps the blood, say in the aorta, against that 100 millimeter of mercury pressure in the systemic vessels, in the aorta, 120 millimeter of mercury systolic pressure. If this pressure is increased, if a person is suffering from hypertension, if the heart has to pump against not 100 millimeter of mercury, 150 millimeter of mercury, the heart has to exert more. So it will cause, it is the pressure load. Pressure load, we are going to see what are the conditions in which pressure load may be there. And then the restricted filling. If heart is not properly filled, something wrong with the filling process. It is being restricted, for example, cardiac tamponade. If the fluid is collected in around the heart in the pericardium, that will restrict the fill. So there are other conditions in which the restricted filling may occur. So proper filling is not taking place, so heart will go into failure. Definition, remember the definition. If the heart is not properly being filled, body needs 5 liters of the blood per minute in a normal person. If the filling is reduced, it will be maybe only 4 liters per minute, maybe there, so there will be cardiac failure. Requirement is 5 liter, filling is less than 5 liter, so restricted filling will another cause of the cardiac failure. Then last one, the damage to the heart, something wrong with the muscles of the heart. For example, we discussed in the previous lecture, that is the coronary artery diseases that has caused damage to the heart. Myocardial infarction causes damage to the myocardium. There are other conditions in which there may be some damage to the muscles, so myocytes loss, something, the muscle loss, something wrong with the muscle. Ischemic necrosis or other condition may cause the damage to the myocardium. So these are a volume load, inappropriate workload, a volume load, pressure load, restricted filling, and the damage to the myocardium. Muscles of the heart are a few causes of the important causes of this heart failure. Now we are going to see what are the conditions in which these overload may occur, or pressure overload may occur, restricted filling may occur. So causes of left ventricular failure, volume load, how the volume load can occur, extra volume which heart is not capable of pumping it. For example, regurgitative valves. The valves are there. Valves ensure the unidirectional flow. If the aortic valve is regurgitating, that is, it is failure, incompetent valve. So the left ventricle will pump stroke volume, whatever may be the stroke volume. Normally it is 70 ml stroke volume. In this condition, stroke volume is more. For example, 100. How it can be 100? If stroke volume is 70 ml, 70 ml of the blood, filling is taking place during diastole, but some of the blood pushed into the aorta will come back because of the regurgitative valves. So this filling and plus more filling, volume during diastole will be not 140 or 150, which is the normal end diastolic volume. We have discussed it. वो इतना नहीं होगा, 120, 130. That will be more. So it will be more. So regurgitative valve will cause more volume in the heart during filling. So this volume has to be pumped. Heart has to pump this extra volume. So this is volume or overload. If the blood volume is okay, our body's blood volume is 5 liter, but still the regurgitation of the valve will increase the volume load on the work heart. With more volume has to be pumped per minute. So because of the regurgitation of the valve, because of the some normal venous return is there, and the some blood is regurgitating back through the valve, aortic valve or the pulmonary valve. So there will be more volume which has to be pumped by the ventricle. So regurgitative valve causes volume overload. There are many conditions we discussed the slide. There are many conditions in which the high output status are there, anemia and hypothyroidism and very diseases. We saw those graphs. In all those conditions, the cardiac output is because of the decreased peripheral resistance. In those conditions, cardiac output has to increase, so volume load is there. When all those conditions in which there is high cardiac output status, there is volume overload, and heart may go into failure. Etiology, one of the cause. Then loss of muscles, that is myocardial infarction, for example, that is loss of muscle post MI after the damage by the ischemic heart disease may cause the damage to the myocardium. So the heart muscle has been damaged, so it may not be able to pump according to the requirement of the body, heart failure. And the chronic ischemia, there are conditions, this is the post-MI, there are conditions in which the gradual chronic ischemia is there, and some bits of muscles have been damaged throughout, but unnoticed damage to the heart. We discussed in the previous lecture, ischemic heart disease. So the chronic ischemia may cause the gradual damage of the myocytes or the myometrium or muscles of the heart. And the connective tissue diseases, there are some diseases which are collectively you will study in your medicine. This is out of our scope, but connective tissue diseases may cause the damage to the myocytes as well, or the muscles of the heart as well, and that will reduce the pumping effectiveness of the heart, and heart may go into failure. Failure is when heart is not capable of pumping the enough blood, a required amount of the blood. Heart may be pumping 10 liters of the blood, but it is not sufficient for the metabolic needs of the body. This person is in congestive cardiac failure. So connective tissue diseases, then some infection, myocytes infection may cause the damage of the myocytes as well. Anywhere, infection can take place anywhere in the body. So this infection. Then some poisons may damage to the heart, for example, alcohol, cobalt, and doxorubicin. There are some chemicals, some poisons which may cause the damage to the myocardium. Not only ischemia, there are other conditions in which the muscles of the heart may be damaged, and this is loss of muscles. This may cause the heart failure. Then the pressure overload we were talking about. If the person is suffering from hypertension, if the aortic pressure, normal, I have got the aortic pressure of mean arterial pressure is 100 millimeter of mercury. If a person has got 150 millimeter of mercury, so the ventricle in those conditions has to exert more. So pressure overload is there. That is the systemic hypertension. If there is, when the person suffering from hypertension, the heart has got overload, pressure overload, and it may go into the heart failure. If there is some obstruction to the blood flow, the heart has to exert more to overcome that obstruction. So narrowing of the vessels may cause outflow obstruction, may increase the pressure overload, and this may cause the heart failure. Then the restricted filling, when something wrong with the filling process, it is not properly being filled. So that is pericardial diseases, anything wrong with the pericardium. That is fibrosed friction, that is two layers of the pericardium, that is visceral layer and parietal layer. If they are jammed together, fluid unme na ho, then the restriction is there. So pericardial disease is something wrong with the pericardial, that covering pericardial. And then the cardiac tamponade, that is the collection of the fluid in the pericardial, in those two layers, that will restrict. And the restrictive cardiomyopathy, there are some conditions in which the muscles, they become constricted, and there is restrictive cardiomyopathy, and proper filling cannot take place. And when proper filling is not there, so the blood supply to the tissues may be reduced, maybe not according to the requirement. So these are some important causes of the heart failure. This is normal output curve. So if there is heart failure, pumping effectiveness is reduced. This lower curves are the curves of the heart failure. So there is pumping effectiveness is being reduced because of the the pressure overload, or the whatever may be the cause, myocytes damage. So normal curve will be like this, downward. We are going to see some curves. This is normal. That is normally in normal curve at 0 millimeter of mercury, there should be pumping of the 5 liter should be there. But if there is some damage, so at 0 millimeter of mercury, only 2 liters or 1 liter may be pumped. So this is cardiac failure. 1 liter is not sufficient for the whole body. So 0 millimeter of mercury, the pumping effectiveness is there. And these curves, these two curves, it is much lower than the 5 liter. So it is cardiac failure. So cardiac output curve after AMI. If one example we are going to take to discuss the cardiac failure. We discussed the acute myocardial infarction in the previous lecture. Coronary artery diseases we discussed. So that will cause damage to the heart. So if there is acute myocardial infarction, pumping effectiveness will be immediately reduced. So normal cardiac output, this is normal cardiac output. In post-MI, the acutely damaged heart, the cardiac output curve will be like this. You can imagine. At 0 millimeter of mercury, almost no pumping, the person may die. But if the person survives, cardiac output, there will be right atrial pressure will be increasing. That will be increasing, and that is maximum increase. For example, that is the plateau. Then plateau occurs. So just after acutely damaged heart, the cardiac output curve is like this blue curve. So what is that is 4 or 5 millimeter of mercury, the pumping is only 2 liters. This is heart failure. The person has gone post myocardial infarction. This is cardiac failure because of the damage to the myocytes has been damaged. Then there will be damage heart. Yeah, let me explain some other parts of this curve. Yeah, dobara bhi aayega. So this will be acutely damaged heart. This will cause fall in the blood pressure, reduce cardiac output, reduce. So baroreceptor we are going. So it will be compensated by the sympathetic stimulation. So this curve will rise after some time. Damaged heart plus sympathetic stimulation may cause the more pumping effectiveness of the heart at the same level, or 5 there will be increased right atrial pressure, and it may go to almost 4 liters, but still it is less than requirement is 5 liters. And so sympathetic stimulation causes the curve like this green curve. They say the curve damaged heart plus sympathetic stimulation after some time. Then there are other compensation. For example, renal compensation fluid will be increased, and that will be increase the pumping effectiveness of the heart to some extent, and it may go to again 5 liter after some time. This is compensated cardiac failure. The 5 liters has been achieved by the partially recovered heart. It has recovered, and it is 5 liter, but at the 6 millimeter of mercury pressure. So these are the cardiac output curve after acute myocardial infarction. So this person below this is the heart failure, and this is normal cardiac output. The heart failure has been compensated. This is compensated cardiac failure, but curve is flat after that. There is no possibility of further rise in the cardiac output curve. Pumping effectiveness, this is the maximum the heart can achieve. That is with the partially recovered heart, 5 liter per पहुंचा दिया, person will survive, but he cannot increase the cardiac output if it is required. अगर आप चाहिए, that's why if the person performs some activity, the person will go again into heart failure. Compensated heart failure will convert it into actual heart failure. वो कर्व नीचे आ जाएगी. So this is the state that the normal is 0 millimeter of mercury. There is normal, and at normal, in a normal person 5 liters is being pumped. But if there is some damage, myocardial infarction has occurred, and this will go to very low level, that is about 2 liters per minute. So this is cardiac failure. Compensation of the acute cardiac failure. How this compensation occurs? Compensated cardiac failure we talked about. How this curve is rising. This was the curve after myocardial infarction. Then it has gone to this, and this has gone to this light yellow curve. So compensation of the acute cardiac failure. If a person goes into cardiac failure, there is fall in the blood pressure. That will be, we had discussed the acute control of blood pressure, baroreceptors. So baroreceptor will be activated, chemoreceptor effect will occur, that will increase the blood pressure, and the CNS ischemic response, the last ditch stand we discussed in the acute control of the blood pressure. So all these three rapidly acting mechanisms will be activated to increase the blood pressure. All these three will lead to the sympathetic stimulation. We had discussed it in the rapid control of blood pressure. This CNS ischemic response, or the chemoreceptors or the baroreceptor, all increase the blood pressure by stimulating the sympathetic system or inhibiting the parasympathetic system. So all this will lead to the stimulation of the sympathetic system and inhibition of the parasympathetic system. Now, sympathetic system stimulation, we know it. This is just a revision. Sympathetic stimulation will cause increased heart rate. It will cause increase the force of the contraction of the heart, and weak myocardium has as a whole, and the remaining normal myocardium. Weak myocardium को भी कुछ stimulate करने की कोशिश करेगा, normal myocardium को ज़्यादा strengthen करेगा, and then this will increase the force of the contraction, and heart rate contraction will try to increase the pumping effectiveness of the heart, cardiac output will increase. And then sympathetic system stimulation causes vasoconstriction, generalized vasoconstriction as well. So that will try to increase the blood pressure because the vasoconstriction causes increased peripheral resistance. And then there is venoconstriction by the sympathetic system as well. Venoconstriction causes increased mean circulatory filling pressure. We had discussed it. Venoconstriction reduces the total capacity available for the blood to be accommodated in the vascular system in the veins. Veins are the capacitance vessel. Their capacity is reduced. That is, venoconstriction increases the pressure inside the vein, mean circulatory filling pressure, on which the venous return depends. So this will increase mean circulatory filling pressure, will increase the venous return, will increase the cardiac output, will try to increase the blood pressure. So that is how sympathetic system increases the blood pressure. Cardiac failure has resulted into decreased blood pressure, so sympathetic system will cause. So because of this sympathetic system activity, heart becomes stronger pump within 30 seconds. We had seen that 30 seconds में sympathetic stimulation. This is very quick. So within 30 seconds, this one. So this was the acute myocardial infarction. Within 30 seconds, within 1 minute. So it has gone to again why the sympathetic system has increased the pumping effectiveness to this level, but still the person is in failure. Abhi bhi failure because we need 5 liters. This is about 4 liters or less than 5 liters. So this has gone to with the sympathetic stimulation. You can see this line arrow I have drawn. So the cardiac output is about 4 liters. So this is sympathetic stimulation within 1 minute of the acute myocardial infarction. So this has gone to 4 liters per minute. Then the third step for the compensation, still the person is in heart failure, chronic cardiac failure. Now time has passed, retention of the fluid by the kidney will occur. This takes time. So retention of the fluid by the kidney, we know it. That is, when the blood flow to the kidney is reduced, then they reduce GFR and reduce urinary volume. That means retention of the fluid is taking place. Less volume is being lost in the urine. So this will cause decreased BP, reduces the renal blood flow. It reduces the glomerular filtration rate, and there is retention of the fluid. And this more fluid will increase the mean systemic filling pressure or mean circulatory filling pressure. That will increase the right atrial pressure to increase the cardiac output. Further increase is taking place because of the increase in the volume. पहले तो सिंपैथेटिक स्टिमुलेशन ने ब्लड वेसल को नैरो करके ब्लड प्रेशर और दी सिंपैथेटिक बैरो रिफ्लेक्स आदि कीमोरिसेप्टर रिफ्लेक्स CNS ischemic response etc. they increase, but fluid retention will increase the right atrial pressure to increase the cardiac output. So recovery of the myocardium may take some weeks, over weeks and months. It may take gradually. It is gradually being recovered. The person may remain in the heart failure for quite a long time. So kidney may take a few weeks to maybe a month to completely recover the myocardium. So chronic cardiac failure will be compensated like this. Now renal retention of the fluid is the person is still in cardiac failure. Still, the total blood pumped is not according to the requirement of the whole body. The person is still in cardiac failure. Urinary output remains low as long as the cardiac output is not sufficient enough. Our blood pressure has not risen to normal level. Our cardiac output has not risen to 5 liters of the blood per minute. So urinary output remains low as long as the cardiac output and blood pressure are low. So compensated. So 2/3 of the cardiac output level. If cardiac output is only 2/3, which we saw in the acute myocardial infarction, there is anuria. There is no urination. At 2 liters, for example, 2 liters or 3 liters, it is 2/3 is less. So there will be anuria, complete absence of urine formation. So the oliguria, if till the full recovery of the cardiac output and blood pressure, reduce urinary output till the full recovery of the cardiac output and blood pressure. So moderate retention of the fluid is beneficial. We know this fluid retention is causing increased mean circulatory filling pressure and increased right atrial pressure, increased cardiac output. This is moderate. But if severe cardiac failure has occurred and the blood pressure is not rising according to the requirement, this will continue. So increase mean circulatory filling pressure will increase the venous return and will increase the cardiac output. But this volume increasing may cause further overload on the heart, which we term as the volume overload. We had discussed it. So the distension of veins will occur, decreased venous resistance will occur, increased venous return if the moderate retention is taking place. This much is beneficial. But if the heart is not too severely damaged, this may be sufficient for the recovery of the heart. If the heart is not severely damaged, it can completely compensate the original loss, which we saw in this diagram. Mein jo humne dekha hua, this has compensation has gone to this 5 liter. So if the 6 right atrial pressure has risen to 6, but the compensated heart failure, it has gone to 5 liter. Now it's okay. The person has got the recovered the damage, that is the now the body is receiving the required amount of blood, that is 5 liter per minute, but there is no cardiac reserve. If this person compensated cardiac failure, this compensation is by the sympathetic stimulation and retention of the fluid. Sympathetic system stimulation is withdrawn gradually. Nervous system is not for the longer control of the this cardiac output. That is immediately, that is important, but later on it is the kidney which will maintain the normal cardiac output by the conserving the fluid and retention of salt and water. So this has gone to this 5 liter, but if this person performs exercise or tries to exert, then this curve cannot increase. Further pumping effectiveness cannot be increased. So person is in compensated cardiac failure. This is known as compensated cardiac failure. This one, that is at 6 liter, it is 5 liter, but the further increase is not possible. Now at rest the person is not in cardiac failure, but if the person performs some activity, the person will go again into cardiac failure. So renal retention of the fluid, if it may continue. If it continues, if damage to the heart is too great, then it cannot go to 5 liters. So this fluid retention will continue. So the decreased pumping effectiveness of the heart, if damage is severe, then the reduced blood flow to the kidneys, it will further increase. Salt excretion cannot cope with the intake, and it will cause salt and water intake will always be more to the salt and water excretion. That is, the excretion has been reduced, so it will cause the excessive retention of salt and water if the damage is too great. And excessive retention of salt and water is damaging. Heart already is at its maximum pumping ability, so further increase in the workload, further increase in the volume overload will cause the further damage to the heart, and the excessive fluid cannot be pumped by this severely damaged heart. So excessive edema will develop throughout the body because the central venous pressure is 6 millimeter of mercury. Throughout the vein, there is increased venous pressure, and whenever there is increased venous pressure, this will leak out. We have discussed the Starling forces. So the capillary pressure will increase, and there will be more leakage of the fluid, and that will cause the excessive edema throughout the body that occurs in all the heart failures. So consequences of the fluid excess, that is increased workload on the heart. When the fluid has increased, so workload on the heart, volume overload has occurred. So overstretching of the heart will occur. When more venous return is there, the atrium and the ventricle are stretching, this will cause the weakening, further weakening of the myocardium, and the pulmonary edema will occur, decreased oxygenation will occur. If the pulmonary edema, if it is left ventricular failure, pulmonary edema will occur. If it is the right ventricular failure, excessive anasarca throughout the body, generalized edema will occur. So excessive edema throughout the body may occur in the right ventricular failure. And so partially recovered heart, what is that? Cardiac output may be normal, हमने देखा था वो normal हो चुका है, but the right atrial pressure has gone to 6 millimeter of mercury, उस कर्व में हमने देखा हुआ है, and the no further fluid retention may occur, and cardiovascular dynamics are all normal at rest except more blood volume and more right atrial pressure. Compensated heart failure में क्या हुआ है? Right atrial pressure has increased to 6 millimeter of mercury and total volume of the blood has increased. This is at rest. But when person performs exercise, this will further increase and the cardiac output is not possible. So systemic sympathetic discharge return to the normal we have talked about, and it is the pulse rate, cold skin, and the pallor all will return to the normal. The signs and symptoms of the cardiac failure will return to the normal, but this is the cardiac output curve is now reached this level. So all the sympathetic system has been withdrawn. It is the only fluid retention and right atrial pressure is 6 millimeter of mercury. This is compensated cardiac failure. So further increase is not possible. Compensated heart failure, cardiac output has returned to the normal. Total pumping ability has been depressed. It is only 5 liter now. So right atrial pressure has been raised 6 millimeter of mercury. This cardiac output is sufficient during rest. But exertion or exercise may cause the return of the symptoms of the cardiac failure. And the maximum pumping ability is only half of the normal. It is only 5 liter. Normally it is 13 liter, less than half of the normal. So we call it as heart is not capable of increasing its pumping ability. What we term as the cardiac reserve is reduced. We will discuss it, cardiac reserve, in next lecture as well. So the compensated heart failure, the normal cardiac output has been achieved, but the person further increase in the cardiac output is not possible. So cardiac reserve has been reduced. Normal person has got the cardiac reserve of about 20 liters. That is in a normal young man. Normal cardiac output is 5 liter, but he can increase his cardiac output up to 25 liters. So 20 liters is the cardiac reserve. But in this person, there is no cardiac reserve. Normal cardiac output is there, but cardiac reserve is not there. We will discuss in next lecture, inshallah ta'ala. Next video, we will continue this discussion and of cardiac failure. We will continue it. So hope you are following me. Thank you very much. If you have got some question, some problem, you can ask in the comment section. And then the final request that is subscribe to my channel and share this video to rest of the medical students so that most students can benefit from it. Thank you very much.